Bien, muchísimas gracias al doctor Juan Francisco Millán por compartir con nosotros la experiencia de SETI Pharma México. Les voy a presentar al siguiente participante de este segundo bloque internacional de nuestro seminario. Andrew Blasi es director de C&M International en Washington, donde guía el desarrollo y la gestión de y multisectoriales a gran escala. Esto incluye el desempeño como secretario técnico desde el año 2010 en la ética de negocios para la iniciativa de las pymes APEC, la alianza público-privada más grande del mundo para fortalecer las prácticas éticas de los negocios en sectores biofarmacéuticos, de dispositivos médicos, que es liderado por el gobierno de los Estados Unidos, con apoyo de todas las otras economías de la APEC, incluido Chile. Y ojo porque él va a tener un importante papel en la preparación precisamente del Foro de la Ética de Negocios para la PEC, para las pymes, que se va a realizar el año 2019 acá en Santiago de Chile. Dejo con ustedes a Andrew Blasi. Bienvenido.
Okay, buenas tardes, mis amigos. It's a pleasure to be back here in Santiago, Chile, and it's also such a pleasure to be back in such a beautiful country that the people of my country in the United States really, truly do admire very much. So it's a real honor to be here. Before I begin, I'd like to extend the best wishes of Lynn Costa and the Trade Promotion Coordination Committee of the U.S. Department of Commerce, based in Washington, that oversees the Business Ethics for APEC SMEs initiative. So they're very much looking forward to hearing about the outcomes of this conference and, of course, our discussions later this afternoon on the Chile Consensus Framework. I'd also, before I begin, like to thank CIF Chile very much for hosting this meeting and for the invitation to come and hear from us and hear more about what's happening in the APEC Business Ethics Initiative. I'd also like to extend my warm welcome to so many friends that are in the audience here today, both from outside of Chile, from so many different countries, but also from here within Chile. I can say that the many different stakeholders here within this country have played an integral role in our advancement of ethical business practices within the APEC context. And I have no doubt that this will not only continue in the lead up to APEC 2019, which will be hosted here in Chile, but very much I think it can be easily said that from all of us within the APEC Business Ethics Initiative, that we really do view Chile as a pioneer. And again, this is something that, especially this year, but in the lead up to APEC 2019, we really see a great opportunity in our collaboration with all of you. All of you in this room have an important role to play for this sector, for the broader health system, in strengthening ethical practices. And it's a real opportunity to showcase Chile and its pioneering effort to lead in this particular space. So kind of setting the scene a little bit for my discussion, I'm going to do three things. The first is I'm going to talk to you a little bit about APEC so that everybody in the room understands a little more about the organization. I think, if for nothing else, that will help everyone be ready for APEC 2019. Then I'll talk a little bit about the APEC Business Ethics Initiative itself, which you've heard already today from Crisula and from several speakers, but I'll dig into a little more details there. And then finally, I'll provide a little bit of a forecast for all of you here in the audience today about the benefits for Chile through this initiative and what we can expect coming up into the future. And certainly, if anyone has any questions, I know we'll do a round of questions, Juan Francisco and I afterwards. Please do feel free to raise them. This is a great opportunity to, as we say, get smart on APEC and on this initiative and how your organizations can really take advantage of our collaboration together in the months ahead. To reiterate, as Crisula did for her presentation, as I go through my discussion today, if any of you have your tablets or you just have general interest in looking into some of the resources of the APEC Business Ethics Initiative, I'd very much encourage all of you to go to mcprinciples.org. Not only are all the key documents and materials from this work all posted on this very user-friendly and interactive site, But for those of you in the room who happen to be compliance or ethics leaders, either for industry or you're non-industry but looking to learn more about how to engage as a government, a patient organization, a healthcare professional body, there's an incredible amount of resources on here for all of you, and many of them are available in Spanish. So I would very much encourage you to go ahead and take a look at that, and of course, if you have questions on those materials, to ask the folks involved in this initiative. Okay, so let's start with APEC. You've seen this map before. APEC consists of 21 member economies that span the Asia-Pacific region. These 21 economies, which includes the United States, and of course it includes Chile, represent a majority of global gross domestic product. They also represent a majority of global trade. So when it comes to major trends, major economic development policies that affect every industry, APEC is a wonderful forum, in fact, probably the world's leading forum that really propagates and promotes economic growth, economic trade, and sustainability. Its goal is very much to see further enhanced integration and alignment of best practices, which I think the connection between the work that APEC is doing to strengthen ethics on a sectoral basis, I think under that parameter makes a great deal of sense. I will also say that APEC is a unique organization, say in comparison to the United Nations or the World Trade Organization or even the OECD in some instances, where APEC serves as an open platform for any stakeholder in the economy to get involved. It is intergovernmental. We'll go through the structure in a bit. But the important part is if you are an industry, a company, an association, healthcare professional, patient, any element within the health system, you are welcome to engage through this platform. And this initiative specifically is a very comprehensive public-private partnership. And so through that, you'll see how it is advancing significant change across the region. APEC, at the end of the day, draws its greatest strength from the fact that it convenes at the head of state level, meaning that all the work that's undertaken through its many different initiatives, many different working groups, all feeds up to the head of state level. And you can see here just last November in Vietnam was the first APEC meeting for our new president, but also your president and the other heads of state for the other 19 economies. And the important role that APEC has as it leads up to this leaders level is the advances, the priorities of the APEC region go all the way up to the head of state level, meaning that especially on issues like strengthening ethical business practices, it is a wonderful platform to really seek endorsement and coverage for champions, such as many of you in this room, to forge ahead on something that is traditionally quite difficult about strengthening ethical practices. It's not necessarily an easy topic. So digging one level deeper, we can see that when it comes to the Business Ethics for APEC SMEs initiative, this particular initiative, it sits within a very important working group in the APEC Forum, the APEC Small and Medium Enterprise Working Group. And this is because whether we talk about the medical device sector or the biopharmaceutical sector, the overwhelming majority of the enterprises that are engaged in these sectors, not only manufacturers and researchers, but also third-party intermediaries. I'm talking about the wider sector. The overwhelming majority of these enterprises across the region are small and medium enterprises. And we'll dig into some of those numbers in just a bit. And the reason I point out between the top picture and the bottom picture is you can see this is a recent meeting of the Small and Medium Enterprise Working Group, which oversees the work that we do in this initiative. The woman in red there serves as the project overseer, most recently, of the Business Ethics Initiative. So now you can start to see the reporting line of how this initiative has direct connection at the head of state level, and in fact, has been endorsed by ministers and leaders on many, many occasions, which provides great ammunition for progress. Okay, so let's talk a little bit about the initiative itself. First and foremost, it is the largest public-private partnership in the world to strengthen ethical business practices in both the medical device and the biopharmaceutical sector. So even though it is within the 21 member economies of APEC, the priorities, the model initiatives that it set have global ramifications. So for example, in the Middle East right now, in countries like Brazil, South Africa, India, they pay very close attention to what this initiative is working on because it has such global ramifications and impact. Launched in 2010, so it's about 7 or 8 years old at this time. Today, there are over 1,500 organizations from across now more than 30 countries that are directly involved in this work, spanning all 6 major continents. This initiative, as I mentioned, is overseen by the US government, but in very close collaboration and with very strong support from all 20 other APEC economies, including the government of Chile. And as I mentioned, of course, the initiative has been endorsed at the highest levels. Now, referring to Chris's presentation, the next question you may ask yourself is, okay, so what is this initiative's priorities? What is it working on? These are clearly set in the Nanjing Declaration's 2020 commitments, and I'll just quickly repeat from what Chris told you earlier. The first priority is to see universal codes of ethics by biopharmaceutical and medical device industry associations. So for any of you in this room that are a part of an industry association that has a code, that's wonderful. I know that we've been collaborating with CIF and with SCDM and with others here in Chile for a long time about code of ethics development, and that's something that the APEC initiative is very proud of to continue to support. We are very much on track to see every single industry association in the region attain a code of ethics that is high standard and aligned with the APEC principles that have already been mentioned, the Kuala Lumpur principles and the Mexico City principles. But there is some work to do, I will say, in this area, and there are several associations here within Chile that do not have a code of ethics. And it's very much our prerogative to see that that be changed by 2020. And we're here to do whatever we can to work with all stakeholders to see that that happens. The second is making sure that once all these codes are in place, and many of them have been in place for quite a while, that they're working effectively. The APEC initiative has a very comprehensive monitoring and evaluation program, in addition to a capacity building and implementation support program. We look specifically at 4 key areas to determine whether each national industry association across all 21 member economies is seeing its code effectively implemented. We look at code governance. Has that code, is it being properly overseen by its members? Was it simply enjoyed by one member but ignored by the others? How well is that association truly embracing that code of ethics? And we monitor that very closely. The second is alignment. Is that code aligned with the APEC, Mexico City, and Kuala Lumpur principles? We're not interested in codes of ethics that are not aligned with the highest standards, and we report that accordingly in our annual assessments. The third is making sure that there's membership adherence. So just because a code may be well governed and may be aligned to best practices, are the member companies following it? And we're doing increasing work to work with associations to begin to pilot assessments directly with individual enterprises. The Philippines championed a major new endeavor in 2017 to go down to the member company level. And it's our goal within the next few years to see assessments done with many, many companies around the region. So you can see that data is a major impetus for how this initiative works. And the fourth and final is external engagement. Is this initiative, are these codes of ethics by industry associations being engaged and socialized with governments, with healthcare professional groups, hospitals, etc., to ensure that it's an ecosystem approach for industry association codes? Which leads us naturally into the third main area, which is consensus frameworks, which I won't go into because I think you've heard at length Crisula talking this morning about the importance of consensus frameworks and what they mean at the national level for bringing all the different stakeholders together. And we're very excited for the work that Chile is doing right now to progress this effort in 2018 prior to APEC 2019 and Chile's host year. So I won't go through this slide in particular. Lo siento, el PowerPoint está en inglés. So I will just briefly highlight some of the key pieces here. 2010 and 2011, that's when the initiative was started. So we saw the launch of the APEC, Kuala Lumpur, and Mexico City principles. In 2012, the implementation program began. At the time, fewer than half, if you can believe it, fewer than half of the pharmaceutical and medical device industry associations in the APEC region had a code of ethics. And I'll show you how that's changed within just the past few years. 2013 saw APEC leaders endorse the need to strengthen ethical business practices for the first time. This was a major catalyst for change, activating champions across each economy who wanted to address this issue, but did not have the right level of political support to really advance this in an aggressive way. And that political support today remains stronger than ever before and was included in the most recent APEC Leaders Declaration just in November of 2017. We also saw major progress, I think it's worth pointing out, major progress in China, which has over 18 industry associations. All of them jointly have committed and are now implementing the APEC principles. So if a health system as complex and as large as China, where you have easily 5,000 manufacturers, 100,000 distributors, can begin to move in the right direction and really begin to embrace these standards, I think every APEC member economy really is well positioned to do so and can make really great strides in this effort. I mentioned the Nanjing Declaration and the continued escalation of what we're referring to as the annual APEC Business Ethics Forum. So every year, this initiative has a major summit. Chris mentioned this year's will be in Tokyo. Next year's forum will be in Santiago. So towards the end of my presentation, I'll talk a little bit more about that. 2016 saw the launch of the first national consensus framework agreements. 2017 brought about additional consensus framework agreements. One thing I'll add to the presentation on consensus frameworks is right now there are over 8 APEC economies that are working on consensus frameworks. So Chile is one of them, but we do expect in 2018 4 or 5 industry or rather entire nations to launch their national agreements. So we very much want Chile to be a part of this next group, especially ahead of your 2019 host year. It's a huge opportunity to be one of the first movers. Australia, China, Japan, Thailand, the Philippines, all moving forward with these types of arrangements in APEC in 2018. It's also worth mentioning, I know we have many members of the medical device industry with us today, that in 2017, we saw the launch of the Inter-American Coalition for Ethical Business Practices in the medical device sector, meaning that under a new set of principles that are aligned with the APEC principles, every single medical device association in the Americas, from Canada to Argentina and Chile, so a total of 19 associations, have formed a new network. This is both international companies, local companies, third-party intermediaries, distributors, all a common network with aligned codes of ethics and standards of best practices. So this is something that the pharmaceutical industry can also be paying very close attention to. I mentioned at the beginning of my last slide, before the prior one, about the changes in codes of ethics. This slide, which is included within the 2017 annual report, and something you can find online, indicates just how much change there has been when it comes to industry association codes within APEC in just the last 4 years. The gray bar indicates associations that did not have codes of ethics in 2012. The left side is pharmaceutical sector, the right side is the medical device sector. You can see that as a propellant through this work, you would be in an extreme minority of industry associations now if you do not have a code of ethics. So for all of you in the room, if you know of industry associations that are thinking about adopting a code, that don't have a code, that should have a code of ethics, or should explore it, this is what you point to. Because you would be in an extreme minority if you were a part of an industry group and you did not have a code of ethics. And this report goes into extreme detail on who those associations are. I won't focus on this slide in particular, all this just to say that the APEC Business Ethics Initiative has a comprehensive strategic assessment process in place. So as we look to fulfill our 2020 commitments within APEC, we're now looking ahead. And it's in our view that Santiago 2019 will be a major opportunity for this initiative to assess where we go from here. What are the ambitions for strengthening ethical practices in the pharmaceutical and medical device sector after 2020? So for that reason, Chile also has a tremendous opportunity to showcase pioneering leadership. How can we move forward in implementing, for example, multi-stakeholder frameworks in a new and innovative way? How can we escalate the role and involvement of patients in the realm of strengthening ethical business practices? How can we more effectively work together within countries and across countries to implement codes, implement best practices at the company level? Is there a regional solution, for example, in digital capacity building? Is that something that could be rolled out at a very extensive level within APEC? All these things are very possible. This just gives you a sense of the size, scope, and participation of the 2016 APEC Business Ethics Forum in Lima. I know many of you, some of you, were in attendance in that meeting. And of course, the initiative has only continued to grow from there. What makes this forum unique from, say, ethics and compliance congresses, which you would typically see in many different settings around the world, is this conference is truly multi-stakeholder. That audience that you see there consists of senior principals, not just leaders of industry associations from all the different APEC economies, but the leaders of over dozens of healthcare professional bodies, health regulators, patients organizations, healthcare providers, etc. So this is a truly multi-stakeholder setting to advance ethical business practices at a strategic level. This is the most recent forum in Hanoi, just in September of this year. These are the launches or the signing ceremonies for the consensus framework agreements in each respective year. So the Peruvian Consensus Framework Agreement was launched at the forum in 2016. And then at the forum last year in 2017, the Vietnamese Consensus Framework Agreement was launched. So let me just take a moment to say, how do we look at, where are we now and where are we going? I mentioned that the Tokyo Forum will be taking place later this year. That will be in July. We will be working with all of the leaders of major organizations here in Chile to make sure you have the information on this meeting, that those invitations are extended, and we would certainly welcome all of you to participate in this major annual summit meeting. We do expect, as I mentioned, the launch of new consensus framework agreements, perhaps Chile's as well. We hope so. To continue to see the implementation of APEC guidance around third-party intermediaries. And of course, advancing digital capabilities and capacity through APEC at the company level in partnership with associations. The 2019 forum, as I mentioned, will be here in Santiago. And these are the key additional goals, as I've already mentioned, that we'll be pursuing through 2020. The 2019 forum here in Santiago, we expect that this very likely could be one of the biggest summits that this initiative has ever held. We will not only be inviting key leaders and representatives from all 21 APEC members, but if the summit in Peru in 2016 was any indication, and given the rapidly escalating scale and participation of organizations in the Americas, we truly do expect this to be not only an Asia-Pacific event, but very much an Americas event that will have significant participation from not just Mexico, Peru, Chile, and North America, but Brazil, Colombia, Argentina, etc. It will be a truly pan-Americas event. We expect to build upon the digital capacity themes of Tokyo this year, but ultimately, we hope all of you will engage through this platform, not only in 2018, but into 2019, because it's a huge opportunity to pioneer innovative change from Chile's perspective, looking outward. How can Chile position itself as a true leader in strengthening ethical practices? This is a real opportunity to shine. And with that, I thank you all for your time and look forward, if you have any questions, look forward to providing more information. So thank you.